So I'm gonna do palpations. So we have our leg right here. We have our patellar tendon. For patella, superior pole, inferior pole, medial border, and then lateral border. Patellar tendon, medial joint line, lateral joint line, tibial tuberosity, distal quads, and then distal hamstrings and distal tendons on the bottom. Lateral femoral condyle, medial femoral condyle, and then up a little bit more is the lateral femoral epicondyle and medial femoral epicondyle. And then we have the head of the fibula, our LCL, MCL, ACL attaches on the tibia, distally, and then goes back, and then PCL attaches posteriorly, and then comes to the front, so they make an X. And then IT band connects on the lateral side of the thigh, and then sartorius comes down. Actually, no, other way. It comes from lateral to medial. So lateral hip to medial knee is the sartorius. And then I'm going to pause it and we'll go to the special tests. So for the first section of special tests, we're going to be checking for knee swelling. So the first one is going to be the sweep test. So I'm going to want to go on the inside, and then I'm going to gently apply compression, and then gently push the patella laterally as far as it'll go, and then we're just going to look for swelling. If there's fluid accumulation, that would be intracapsular swelling of the patella. And then ballotable patella, I would just lightly push the top. And then if the downward movement of me pushing my finger on the top is followed by any rebound, there is moderate to severe joint effusion. And then for the bounce home test, I'm going to have you flex your knee up, and then you can just relax. I will gently pull it down and let it fall. And if there's any, so it's negative, but if it were to bounce up again, that would be a positive for bounce home test, and there would be really bad swelling in the knee. And then for girth measurements, we would measure on the joint line of the knee. We would measure from the joint line, and then 3 centimeters, 6 centimeters, and then 9 centimeters above and below the joint line. If the injured leg is bigger than the limb, then there's swelling, injured, positive. So if there's a difference by a centimeter between 3, 6, and 9, then that's a sign of atrophy in the muscles.